Hi, my name is Daniel Frey. I'm an RN. I'm here to do an assessment on you. How are you doing?
Good, how are you?
Good. What is your name?
Evelyn Robinson.
Okay. Well, I'm going to go gather some equipment, and I'm going to wash my hands, and then we will get started. One of the things you need to know is that we're basically going to be looking at your for the head-to-toe assessment is from top to bottom. I'm going to be touching you, putting my hands on you, feeling around for certain things, and we're going to be using the scope and pen light and all that stuff to just make sure that everything's appropriate. It's a private room, and if you're worried about privacy in any way, shape, or form between the two of us, I have a gown you can wear and while we're doing the assessment.
Okay.
Grab my stuff, wash my hands, come back. And first thing I'm going to do is I'm going to look at your head. And I'm going to notice that symmetry is present. I'm going to inspect the scalp. Notice that the scalp is moist and intact. There are no lesions, bumps, or masses present. That everything is intact. Now I'm going to do the level of consciousness. Can you tell me where you are?
In Waynesville,
And can you tell me today's date?
December 13th,
And you tell me who the president is?
Trump.
So I'm going to say that the patient is alert and oriented ×4. I've noticed that the hair is appropriate, that the definition of it looks normal. First thing I'm going to do after that is we're going to go ahead and look at your eyes. I noticed that you wear glasses. Do you know what your vision prescription is?
I can't remember.
Okay. Normally at that point we would do a Snellen check where we check for 20/20, 20/40, 20/50, which essentially means 20 feet away from the target, you cover one eye, and we can check each eye to see its appropriateness from 20 feet away, what a normal person vision would be. From here, what I'm actually going to do is assess strain on nerve 2 and 3 by putting a pen light in your eye, and we're going to go ahead and check the pupillary response, the retinas in your eye. Excuse me. Sorry. And can you remove your glasses for me, please? So if you can, just maintain your vision on this finger, and I'm going to drag the light into your eyes, and as I do that, I'm looking for pupillary constriction. I'm going to do the same with the other eye. And now, can you do me a favor and follow my eye? Okay. Now, can you look left? Yeah. Sorry, my left. I'm sorry. And then right. And then can you look up and down? And can you move your head up? Down? Just move your head all the way. And can you put your chin to your chest? Essentially what I'm doing here is making sure that we just go ahead and get out of the way of range of motion for the neck and stuff like pupillary constriction being super important as the cranial nerve 2 and 3 really especially are present and reactive and intact. And it does appear that perla is intact, present, and that the sclera and retina and cornea are all intact. And I'm going to, if I can, I'm going to pull your eye down, and I'm going to look with my pen light into your eye. I'm going to check your conjunctiva sac. Is that okay?
Mm-hmm.
The conjunctiva sac appears to be intact. The lacrimal sac is intact and in place. In the right position. The iris is intact. Everything looks normal, healthy. There are no cuts, bruises, lesions, any kind of abnormalities. There's no irritation, redness, swelling, tenderness. And what we're going to do now is actually palpate. Now that we've inspected everything and looked at everything, we're going to palpate your frontal and maxillary sinuses for any tenderness and any masses. It does appear that everything is intact. Transmandibular joint, right here. Everything appears to be intact. There are no signs of swelling, abnormalities, no lesions. And I'll notice as I'm doing this that the patient's skin is the right temperature, warm, moist, intact, clean. And after I'm doing that, all I'm going to do is go to the ears. Actually, I'm going to have to get on my knees. And I'm going to pull the pin up, and I'm going to be looking straight into the ear canal. And as I'm doing this, of course, I'm going to notice the skin on the ear, that the skin is pink, warm, and intact, and that the ear canal is free of cerumen, and that it is clean and intact. The tympanic membrane is intact and gray. It is clean. There appears to be no signs of irritation or redness. I'm going to do this by both ears. If I can do the same over here. You pull your ear up. I'm going to be looking in, and I'm just looking at the ear and the skin around it. Noticing the skin is pink, warm, and intact. Mucous membranes inside the ear are dry and intact and appropriate. The ear canal is clear of cerumen and is pink and intact. The tympanic membrane is gray and intact with no signs of irritation, lesions, cuts, or anything like that. There appears to be no masses present and no irritation. So now what I'm going to do is I'm going to actually check your nose. And now we've checked your sinuses, so we have know that your frontal and maxillary sinuses are clear and clean, and that there are no signs of irritation, lumps, or masses. What I'm going to do is first look at your nose with my pen light, and I'm actually looking for symmetry in all this, and which I of course was doing in the first place, is looking at symmetry for all object on the face. If the bone structure is normal, those ears are drooping, and everything has symmetry. So essentially, look at your nose real quick. And we'll be looking at the nose canal and seeing that the mucous membranes are intact and moist. There's no signs of irritation, bleeding, or lesions or bumps. There are no masses that are visible. We do this by both nose and nostrils. Now I want to ask you if you can please, can you just close one nose and then breathe out of it, just to make sure it's patency. Both nostrils appear patent and intact. There are no signs of swelling, tenderness, lesions present. Patient, are you having any pain anywhere that we need to know about? Okay. So we're going to check your mouth. Can you please, I'm going to notice that the lips are warm and intact, and that they are moist, and that the skin around the face is moist and intact. There appears to be no signs of irritation or lesions present, no swelling or masses or lumps. Can you get over your mouth? Can you say awful? The uvula is reactive and present. The tonsils are +2 and in place. The oral mucosa is clean, moist, and intact. There appears to be no sign of dental caries. The teeth are intact. The buccal mucosa is intact and pink. The tongue appears to be intact. There is no signs of swelling or lesions present. The gum line appears to be intact. There's no signs of bleeding, no bumps, no lesions, no swelling masses. Do you have any problems right now with your mouth or anything like that? Okay. Can you do me a favor and can you put your tongue in the top of your mouth? Okay. Now what I'm going to do is I'm going to palpate, or so I'm going to touch your neck, and I'm going to be looking at your lymph nodes for lumps. So I'm going to be checking your thyroid and your parathyroid. So as I do, I'm going to be grabbing and just lightly palpating for the parathyroid and thyroid. It appears that the thyroid is intact, the trachea is midline and intact and patent. There's no sign of swelling, bruises, masses, lumps. Everything seems to be fine. Okay, so from here, I think we need to actually get you turn around so that you can see. So now what we're going to do is I'm going to come back here and we're going to do a chest exam. I'm going to be looking for unilateral breathing bilaterally. We've been making sure that everything is symmetrical, everything's unlabored, and that we're looking for tactile firmness. And we palpate the skin, making sure that we feel where the lumps are. We notice the spine and we'll be looking at the skin, making sure everything's clean, warm, and intact. The skin is pink. It is dry. I'm going ahead and after palpating and finding tactile firmness and that everything is where it needs to be, and of course inspecting first, we're going to auscultate. So auscultate your lungs. I'm going to start here and listen for one in and one out each. Now, I'm not going to make you do a bunch of deep breathing because that would just kill you. Not ready for that. And we're looking at the lungs for signs of adventitious breath sounds or friction rub. You notice that the breathing is normal, the rate is normal, it's 18 breaths a minute. There is no signs of bronchi or crackles. There is no wheezing present. The client's breath sounds from here are clear, unlabored, and intact bilaterally. Let me just turn it back around so I can read it in color. Okay. So now we're going to listen to your lungs on the front. And what we're going to do first is, of course, look at the symmetry of the shoulders and chest and the way that it rises to make sure that the breathing is still thoracic and unlabored and that there is no, the patient doesn't have any issues with breathing. As we look at the patient, we notice that the breathing is symmetrical and she is breathing bilaterally through both lung fields. So I'm going to take my stethoscope, and I'm also going to look at her skin and notice that the skin is pink, warm, and intact. There is no sign of dryness, irritation, lesions, bumps, anything like that. I'll feel her, of course, for that. So listen to you breathe. Notice that there is no adventitious breath sounds. There's no crackles, no bronchi, no wheezing, no friction rub present. So the patient has clear breath sounds bilaterally in all quadrants, or in all fields, I should say. Sorry, not quadrants. And we would have done a breast exam. We're not going to do that now, but we would have done a breast exam here and check the breast for lumps, masses, swelling, any kind of discharge from your nipples, any kind of asymmetry that would have been placed, and we're going to note that and do a follow-up designated focus assessment on there from there. From here, what we're going to do is, actually, we're going to check your lymph. So, I'm going to ask you to lift your arm up for me, and I'm going to check the lymph now. And I'm going to laterally palpate. Now I notice that the lymph is intact. There are no signs of swelling, bruises, lesions, lumps. And just going back to the breast exam, is that I did not notice any sign of swelling, no lumps, no masses, no tenderness. Everything is pink, warm, and intact. The skin, there's no discharge, and everything is symmetrical. So I'm asking you to lift this arm up, and we're going to feel over here. And as we do that, we laterally feel for any lumps, swelling, masses. Okay. There is no palpable masses, swelling, bruising, or lesions. Everything appears to be intact. There are no lumps present. So from here, what I'm going to actually do is ask to do a range of motion of the upper extremities. If you can put your arms all the way up for me, and all the way down, and you bring your arms all the way forward, and all the way up. There you go. All the way down. Okay. And I'm going to kind of do while I'm here doing this is I'm going to say, can you push on my hand? Can you push on my hand with this? Okay. So now we're going to check your extremity stretch. Well, actually, you know what? Before I do that, I'm going to go ahead and check the radial pulse on each arm. It is at 80 beats per minute. It is appropriate, palpable by ×2. The capillary refill is less than 3 seconds. Perfusion seems appropriate. Everything is pink, warm, and intact. Do the same with this one. We're going to check for pulses. Of course, radial pulse. Capillary refill after 3 seconds. Everything is pink, warm, and intact.